Hi, I'm Dr. Adrian Cole. I'm a physician, medical educator, and science communicator. My goal is to help you better understand your health using clear, evidence based medical science so you can make informed decisions for a healthier life. A healthy liver can continue working even after years of silent damage. In fact, many people with early liver disease feel completely normal because the liver has an extraordinary ability to compensate while injury slowly develops beneath the surface. By the time symptoms such as fatigue, discomfort in the upper abdomen, or abnormal liver blood tests appear, significant changes may already have taken place. Many people believe that alcohol is the biggest threat to liver health. While excessive alcohol can certainly damage the liver, modern medical research shows that some of the most common foods we eat every day can also place this remarkable organ under constant stress. Diets high in added sugars, refined carbohydrates, unhealthy fats, and heavily processed foods may gradually disrupt normal liver metabolism and promote the buildup of fat within liver cells. The encouraging news is that many of these risks are preventable. Understanding how your liver works and recognizing which foods have the greatest impact on its health can help you make small, practical changes that support your metabolism, energy levels, and overall well-being for years to come. In the next few minutes, we'll explore 5 everyday foods that may be quietly damaging your liver, explain why they affect the body the way they do, and discuss what current scientific evidence recommends for protecting this vital organ through healthy lifestyle choices. Our first food group is highly processed sugary foods and sweetened drinks. Excessive intake of added sugars, especially fructose from sweetened beverages and processed desserts, can increase fat production inside the liver and contribute to metabolic dysfunction. We'll examine why many people underestimate sugar's effect on liver health and what scientific evidence says about reducing this hidden risk. Next, we'll look at ultra-processed fried and fast foods. Foods rich in unhealthy fats, refined carbohydrates, and excess calories can promote chronic inflammation, insulin resistance, and fat accumulation within liver cells. We'll explore how these foods affect normal liver physiology and why moderation plays a key role in preventive health care. Finally, we'll discuss processed meats and excessively salty packaged foods. Frequent consumption of processed meats and high-sodium convenience foods has been linked with poorer metabolic health and may indirectly increase the risk of liver disease through multiple lifestyle-related pathways. We'll look at what current research shows, what questions scientists are still investigating, and how healthier eating habits can better support lifelong liver function. Highly processed sugary foods and sweetened drinks. Excessive intake of added sugars, especially fructose from sweetened beverages and processed desserts, can increase fat production inside the liver and contribute to metabolic dysfunction. We'll examine why many people underestimate sugar's effect on liver health and what scientific evidence says about reducing this hidden risk. One of the most common misconceptions about liver health is that only alcohol can damage this vital organ. In reality, your liver is responsible for processing nearly everything you eat and drink, including the sugars found in many everyday foods. While the body needs small amounts of naturally occurring sugars from whole fruits and dairy products as part of a balanced diet, the concern lies with excessive amounts of added sugars, particularly those found in soft drinks, energy drinks, sweetened coffee beverages, packaged desserts, candies, and many processed snacks. To understand why this matters, it helps to know how the liver works. The liver is the body's central metabolic organ. It helps regulate blood sugar, stores vitamins and minerals, produces bile for digestion, processes nutrients, removes toxins, and converts excess energy into stored forms that the body can use later. When large amounts of added sugar are consumed regularly, especially fructose, the liver is placed under a greater metabolic workload. Unlike glucose, which can be used by many tissues throughout the body, much of the fructose we consume is processed primarily by the liver. When intake is modest, the liver handles this efficiently. However, when large amounts are consumed day after day, the liver may begin converting excess fructose into fat through a natural metabolic process called de novo lipogenesis. Over time, this can contribute to fat accumulating within liver cells, a condition commonly associated with metabolic dysfunction-associated steatotic liver disease, formerly known as non-alcoholic fatty liver disease. This process usually develops silently. Most people feel perfectly healthy during the early stages because the liver has an impressive ability to continue functioning despite gradual changes occurring inside its cells. That is why liver health often receives less attention than heart health or brain health, even though all three are closely connected through metabolism. Another misunderstanding is that only overweight individuals need to worry. Although excess body weight increases the risk, people with normal body weight can also develop fatty liver if they regularly consume high amounts of sugary beverages and highly processed foods while leading a sedentary lifestyle. Genetics, insulin resistance, sleep quality, and physical activity all influence how the body responds to excess sugar. Research consistently shows that sugar consumed in liquid form deserves particular attention. Sweetened beverages provide large amounts of rapidly absorbed calories without creating the same feeling of fullness that whole foods provide. As a result, people often consume more calories than they realize. Frequent consumption may contribute not only to liver fat accumulation, but also to insulin resistance, elevated triglycerides, and an increased risk of type 2 diabetes and cardiovascular disease. These conditions often occur together because they share common metabolic pathways. It is equally important to recognize the difference between naturally occurring sugars and added sugars. Whole fruits contain fructose, but they also provide fiber, water, vitamins, minerals, and beneficial plant compounds. The fiber slows digestion and reduces the rapid delivery of sugar to the liver. For most people, eating whole fruits as part of a balanced diet is associated with positive health outcomes rather than liver damage. One practical habit that supports liver health is learning to recognize hidden sources of added sugar. Many breakfast cereals, flavored yogurts, packaged sauces, sports drinks, and even foods marketed as healthy may contain significant amounts of added sweeteners. Reading nutrition labels and choosing minimally processed foods more often can gradually reduce overall sugar intake without requiring extreme dietary restrictions. Regular physical activity also plays an important role. Exercise improves insulin sensitivity, encourages muscles to use glucose more effectively, and helps reduce excess fat stored in the liver. Combined with adequate sleep, a balanced diet rich in vegetables, whole grains, lean protein, healthy fats, and regular movement, these lifestyle habits create an environment that supports healthy liver function over the long term. If you have risk factors such as obesity, type 2 diabetes, high cholesterol, high triglycerides, or persistently abnormal liver blood tests, it is important to discuss them with a qualified healthcare professional. Early evaluation can identify liver changes before symptoms develop, allowing preventive strategies to begin when they are most effective. As we move forward, another category of foods places a different kind of stress on the liver. While excess sugar encourages fat production, the next group combines unhealthy fats, refined carbohydrates, and excess calories in ways that can further disrupt metabolism and increase inflammation. Let's take a closer look at ultra-processed, fried, and fast foods. Ultra-processed, fried, and fast foods. Foods rich in unhealthy fats, refined carbohydrates, and excess calories can promote chronic inflammation, insulin resistance, and fat accumulation within liver cells. We'll explore how these foods affect normal liver physiology and why moderation plays a key role in preventive health care. Many people assume that the biggest concern with fast food is simply weight gain. While excess calories certainly play a role, the effects go much deeper than the number on the scale. The liver is one of the body's busiest metabolic organs, and every meal sends nutrients through it for processing. When meals are consistently high in refined carbohydrates, unhealthy fats, and excessive calories, the liver must work much harder to manage these nutrients. Over time, this constant metabolic overload can contribute to changes that affect not only liver health, but also the heart, blood vessels, and the body's ability to regulate blood sugar. To understand why, it helps to think of the liver as a sophisticated processing center. After food is digested, nutrients travel from the intestines directly to the liver through a major blood vessel called the portal vein. Here, the liver decides whether nutrients should be used immediately for energy, stored for later, or converted into other substances the body needs. This system works remarkably well when meals are balanced. However, when the diet is dominated by highly processed foods, the balance begins to shift. Many fried and fast foods are rich in refined starches, added sugars, saturated fats, and often large amounts of sodium. These foods are also typically low in dietary fiber, which normally slows digestion and helps regulate blood sugar levels. Without enough fiber, carbohydrates are absorbed more quickly, causing larger increases in blood glucose and insulin. Repeated spikes in insulin may gradually contribute to insulin resistance, a condition in which the body's cells become less responsive to insulin signals. When insulin resistance develops, the liver often begins storing more fat within its own cells. This is one of the major pathways leading to metabolic dysfunction-associated steatotic liver disease. Excess fat inside liver cells can interfere with normal liver function and may also trigger low-grade chronic inflammation. Unlike the short-term inflammation that helps heal an injury, chronic inflammation develops slowly and may contribute to long-term damage if the underlying lifestyle factors are not addressed. Another important factor is the type of fat present in many ultra-processed foods. Fried foods prepared in repeatedly heated cooking oils may contain compounds formed during high-temperature cooking. Laboratory research suggests that some of these compounds can increase oxidative stress, a process in which unstable molecules called free radicals place stress on cells. Although the body has natural antioxidant defenses, consistently consuming foods that promote oxidative stress may overwhelm these protective systems over time. Research in this area continues to evolve, but maintaining a diet rich in whole foods remains a well-supported recommendation for overall health. Portion size also matters. Fast food meals today are often much larger than they were several decades ago. A single meal may provide more calories, sodium, and unhealthy fats than the body needs at one sitting. If this pattern becomes routine, excess energy is stored as body fat, including fat around the abdominal organs. Visceral fat is metabolically active and is strongly associated with insulin resistance, cardiovascular disease, and liver fat accumulation. One encouraging message is that liver health often improves when healthier habits are introduced. Scientific studies have shown that modest weight loss, regular physical activity, and improved nutrition can reduce liver fat in many individuals. Even a daily walk, combined with resistance exercise several times each week, helps muscles use glucose more efficiently, reducing the metabolic burden placed on the liver. Choosing meals built around vegetables, fruits, legumes, whole grains, lean protein, fish, nuts, seeds, and healthy unsaturated fats provides nutrients that support metabolism while reducing unnecessary stress on the liver. Preparing meals at home more often also gives you greater control over ingredients, cooking methods, and portion sizes. These changes do not require perfection. Consistency is far more important than occasional indulgence. It is also worth remembering that liver disease often develops without obvious symptoms. Persistent fatigue, unexplained weakness, or abnormal liver enzyme results on routine blood tests deserve medical evaluation, particularly in people with obesity, type 2 diabetes, high blood pressure, or elevated cholesterol. Early detection offers the best opportunity to reverse many of these changes through evidence-based lifestyle medicine. The foods we have discussed so far mainly affect the liver by disrupting metabolism and encouraging fat accumulation. The next category presents a different challenge. Processed meats and heavily salted packaged foods introduce additional dietary factors that may further influence liver health through their effects on metabolism, inflammation, and overall dietary quality. Let's explore why these everyday foods also deserve closer attention. Processed meats and excessively salty packaged foods. Frequent consumption of processed meats and high-sodium convenience foods has been linked with poorer metabolic health and may indirectly increase the risk of liver disease through multiple lifestyle-related pathways. We'll discuss what current research shows, what remains under investigation, and how healthier eating habits can better support lifelong liver function. Many people think of salt as something that only affects blood pressure and processed meats as a concern primarily for heart health. While those are certainly important considerations, research over the past decade has shown that diets built around heavily processed foods may also influence liver health. The relationship is more complex than with added sugar or excess calories, but it is an area where nutrition science continues to provide valuable insights. Processed meats include foods such as bacon, sausages, hot dogs, salami, pepperoni, and many deli meats. These products are often preserved using salt, nitrates, or nitrites, and may also contain added sugars, saturated fats, and various food additives. Individually, these ingredients are not always harmful when consumed occasionally, but frequent consumption as part of an overall unhealthy dietary pattern may contribute to metabolic problems that place additional stress on the liver. The liver depends on a steady supply of balanced nutrients to perform hundreds of essential tasks every day. It helps regulate cholesterol, stores energy, produces proteins needed for blood clotting, supports the immune system, and removes waste products from the bloodstream. When a person's diet regularly consists of highly processed foods and very little fresh produce, whole grains, legumes, or healthy fats, the liver may receive fewer of the nutrients needed to support these complex processes efficiently. Scientific evidence suggests that people who consume large amounts of processed meat often have higher rates of obesity, insulin resistance, type 2 diabetes, and cardiovascular disease. These conditions themselves are well-established risk factors for fatty liver disease. In other words, processed meat may contribute as part of an overall dietary pattern, rather than acting as the sole cause of liver disease. This distinction is important because medical research aims to separate direct effects from broader lifestyle influences. Sodium is another factor worth discussing. Most people associate sodium with the salt shaker, yet the majority of sodium in many modern diets comes from packaged and restaurant foods rather than salt added during cooking. Instant noodles, packaged soups, frozen meals, savory snacks, processed cheeses, canned meats, and many ready-to-eat meals can contain surprisingly high amounts of sodium. Although sodium does not directly create fat inside the liver in the same way that excess sugar can, a diet consistently high in sodium is associated with hypertension and may contribute to fluid imbalance in certain liver conditions. For individuals who already have advanced liver disease, excessive sodium intake can worsen fluid retention, making medical management more challenging. For the general population, reducing excess sodium supports cardiovascular health, and because the heart and liver work closely together through the circulatory system, protecting one organ often benefits the other. Another emerging area of research involves the gut microbiome. Your digestive tract contains trillions of microorganisms that help digest food, produce beneficial compounds, and interact with the immune system. Diets rich in highly processed foods and low in fiber may alter this microbial balance. Scientists are investigating how these changes may influence inflammation and liver health through what is known as the gut-liver axis. While this research continues to evolve, there is strong evidence that eating more fiber-rich foods supports a healthier gut environment. One practical strategy is to shift the focus away from processed convenience foods and toward minimally processed meals whenever possible. Fresh vegetables, fruits, beans, lentils, whole grains, fish, poultry, nuts, seeds, and olive oil provide vitamins, minerals, antioxidants, and fiber that support healthy metabolism. Preparing meals at home more often also allows better control over sodium, added sugars, and saturated fat. Reading food labels can be surprisingly helpful. Comparing products often reveals large differences in sodium content, even among similar foods. Choosing lower sodium options, limiting processed meats to occasional rather than daily consumption, and replacing them with lean protein sources are evidence-based habits that support long-term liver health without requiring restrictive diets. Regular exercise, adequate sleep, maintaining a healthy body weight, and avoiding smoking further strengthen these dietary changes. Lifestyle medicine recognizes that no single food determines your health. Instead, your overall pattern of eating, movement, sleep, and preventive health care shapes your long-term risk of chronic disease. If routine blood tests show abnormal liver enzymes, or if you have risk factors such as obesity, diabetes, elevated cholesterol, or a family history of liver disease, it is wise to speak with a qualified healthcare professional. Early assessment and personalized guidance can often identify problems before symptoms appear and help protect liver function for years to come. Now that we've explored the 5 major dietary patterns that can quietly place stress on the liver, it's time to bring everything together and look at the simple, evidence-based habits that can help keep this remarkable organ healthy throughout your life. Good luck and take good care of your health.